Hi, my name is Andy Winnett. I'm one of the nursing faculty at the Rankin campus of Hines Community College. I'm going to be demonstrating today how to do a sterile dressing change on a surgical incision. The first thing that I want to do before I do anything else is to make sure that there's an order to change the dressing and whether or not there needs to be another dressing put back on it, or if they want to put something different back on it. Typically what we will do is the same exact thing that we took off is what we're going to put back on, unless they say that it's open to air. Now, another thing that I want to do is knock on the door, introduce myself. I want to wash my hands. I want to introduce myself to the client. Hi, I'm Andy Winnett. I'm going to be your nurse today, and I need to do a dressing change on your surgical wound on your right leg. Is that okay? So I want to ask and make sure that it's okay for me to change the dressing. If there's any assessment to be done, I'm going to do it during the dressing change while I'm assessing the wound, okay? So what I'm going to do is I'm going to go ahead and raise the head of the bed to my working height, and that for me is right at my belly button. I have my biohazard bag at the end of the bed. I have my supplies here on the table. I need saline. I need a pair of clean gloves. I need some tape. I need 3 4x4 packages, 1 ABD pad, and 1 set of sterile gloves. Now, if you think for 1 minute that you might contaminate those gloves, go ahead and bring 2. It's okay. You can use one. If you contaminate, you can get the other pair and just keep going. So I have actually placed my patient at a working level that's comfortable for me, and I want to only uncover the part that I'm going to be working with. Alright, and I see that the dressing is on the right leg. At this point in time, I want to ask my client or my patient, can you tell me your name and date of birth? And do you have any allergies? And I check that against the wristband, not just, okay, I'm kind of perusing it. I want to make sure that what he says is on here, date of birth is on there, and if he has an allergy sticker on, then I want to make sure that they match what he says. Okay, like I said, first thing I'm going to do is I'm going to expose the leg. Try not to expose too much. I don't want my sheet in my biohazard bag either. You're going to learn to drive with your feet. So what I'm going to do first is put on a clean set of gloves, because I'm going to remove the old bandage. These are really tight. Alright, so I'm going to place my hand on the tape like so, and I'm going to then put my finger right beside the place where I'm peeling the tape off. That way I don't macerate the skin. And put this in the biohazard. I want to do the same thing with this side. It doesn't want to come off very well, but that's okay. Are you okay? Does this hurt? Or should I slow down? No? Okay, thank you. You always want to make sure that your client is comfortable. Usually if they're not, they will tell you before you ask. Okay, this side has another piece of tape on it. This side piece of tape on it. This is what they call a window dressing. Alright, I want to take this and I want to make sure that I open it away from the client's face, and I want to very gently move it up and away to make sure that there's not a drain under there that I haven't seen. If any of this sticks to the wound itself, I definitely want to make sure that I don't pull that I can put some saline on it and loosen it up. And what I'm looking for on the bandage is the color, the odor, the consistency, and the amount of the drainage that is on this bandage. If it's completely saturated, that's what I would document, and I would note what color it is. If it's bright red bleeding, then we have a fresh bleed. If it's brownish to black, it's like old blood that came from when they were in PACU probably. So once I've done that, I can throw this away. Okay, now, just like before, I want to get my sterile field the way I want it. And I'm triangulating myself with it so that when I do this, I'm not tempted to contaminate. Okay, I have no visible soiling on these gloves, so I'm going to take them off and I'm going to discard them. At this point, I'm going to teach you how to do a two-handed sterile dressing change. So what I want to do first, and I've already done this, is to take this ledge. See, it says it's open here. I want to take the bottom ledge and I want to fold it. That way my package will stay open. Now, 1/4 of this, 1/4 of an inch, is what we consider to be contaminated. And I'm having trouble opening the top. There we go. So what I want to do, or what I normally do, is I open this package and I walk my way back over to the other side. Okay, my bandage is not contaminated, but if it was, I would say so. Alright, I'm going to do the same with the other two. And I'm doing this direction because I don't want to cross over my sterile field. If I were to do it from here to there, I would have much more difficulty in trying to keep that field sterile. And I go from the first thing that I'm going to use to the last thing that I'm going to use. Three, and now this is my ABD pad. I did the same with it, folding the bottom. And no, I can't open this package. Okay, now we're good. Okay, I don't know if you can see it. Ms. Pittman, if you wouldn't mind, there is a baby blue seal around this where it has stuck together with the top part. This portion of this package is considered not sterile. Anything inside that blue is considered to be sterile and do not contaminate it. So what we're trying to do at this point is make sure that we don't move okay, And I did that without contaminating any of those three. Okay, so now what I want to do while I'm not sterile is I want to go ahead and I'm going to take my cleansing solution, which is going to be sodium chloride. If this is a new bottle, then I want to make sure that I put an open date, a time, and my initials on the sticker. Okay. We always want to hold the bottle by the sticker so that water, if it lips over, won't make any of this disappear. All right. So what I want to do is I'm going to go ahead and pull my tape. I need 4 pieces for my window dressing. Okay, now that I've done that and I've checked to make sure that the expiration date is not that the bottle is not out of date, I want to go ahead and I want to pour just a little bit on my 4x4s, and then at this point I'm going to put on my sterile gloves. Are you okay? Thank you. May I go ahead with the dressing change? Thank you. Okay, so none of this is sterile. I can play with this all day long. What I want to do, see it says cuff end here. I'm going to go ahead and open it. And I'm going to turn it to me. Now, I have a good 1.5 inches between me and what's here above me that needs to stay sterile. So when I open these gloves, I'm going to take and I'm going to gently fold this back so it'll stay. I'm going to do the same thing for this down here. And then I'm going to open my gloves. And they are completely stuck together and I have no idea where the thumb is. So we're just going to do this. So I'm going to pick up the first glove, touching only the wrist part, and I'm going to put that one on. Do not pop your glove. Alright, this time I need to be able to grasp this portion. There's my thumb. That way. No. That way. Okay. Now I can fix the insides. From here, I don't necessarily need to put this anywhere. It's not in my way. It's not doing anything to harm anything. So what I would like to do at this point is I'm going to, because I have 2 hand sterile, take my sterile gauze and I'm going to squeeze out the excess. And I'm going to change hands. I'm right-handed, but this is the client's right leg, so it's easier for me to do this from the left side. I want to go from clean to dirty with this. So what I'm going to do is I'm going to start with the incision. The incision is in the middle. We're going to do that, and then we're going to discard, but I'm going to keep this one because I need it one more time. Alright, so I need to do the other side, and I need to get this, squeeze out the excess, and I'm going to clean the inner medial aspect, and then from here I can discard. So now I'm going to come over here and take this one, squeeze out the excess. I'm going to clean the side closest to me without going over the other 2 sides, and then I'm going to throw that away. Don't need it anymore. So now I'm going to put my dressing back on. I'm going to take a 4x4 and I'm going to lay it down. And And I'm going to take my ABD pad. I can touch 1/4 of an inch of it. The blue stripe side is what you need to see. The underside does not have one, so that means it goes closest to the wound. So I'm going to take this and I'm going to lay it down on top of my wound, and I no longer have to be sterile. So now I want to do, or what I want to do, is take and tape my dressing to the client's leg. I typically try not to let go of it until I get at least 2 sides taped down, because then I'm not scared it's going to come off. Do the one away from me first. One thing that I would suggest you do is make sure that your client is not allergic to certain types of tape, because there are people who are allergic to adhesives, and we would have to come up with a different way in order to keep this dressing on. We can use either Curlex or another type of something that could go around it to keep it in place. But at this point, I'm all done. He's done. I want to take these gloves off. I want to bundle that one in my hand, and I'm going to go underneath. I'm going to peel this off. So now I can clean up. Move this away. I don't need it anymore. I'm going to put his gown back down. I'm going to cover his foot back up. Do you feel okay? Did that hurt at all? Okay, good. I'm going to go ahead and put your side rail back up. I'm going to lower your bed. Okay, and I am through with the procedure. There is one aspect that I did not talk about, and that is to assess the wound itself. If this is a wound that's an incision, which is what we're doing, if it's stapled together, I like to count the number of staples that are in it, because when they decide to take these stitches or staples out, sometimes the skin grows over them and you can't see them. So I always count the number. And then I also want to look to see if the wound edges are approximated. And what that means is that both sides of the skin are touching. If it is not approximated, it's considered an open wound. Sometimes they do that on purpose. They will maybe have someone that they need to use a wound vac on to get it to heal, but you won't see a dressing on that one. They may have one that they'll use Montgomery straps on that we'll talk about later, to leave it open, and then we would do a wet to dry dressing. It would not be sterile. But this dressing right here is considered sterile. When I go to document what I did, I want to note the color of the drainage that was on the old bandage. I want to note the odor, if there was any. The consistency, is it purulent, is it thick, is it thin, and then the amount. And that's just an estimation, because we can't actually weigh that ABD pad. I want to note if there was a drain there. I would make a note about the drain, either it's intact and doing its job. I would also want to look at I think I forgot what I was going to say. But anyway, basically when you document on this, you want to document every aspect of the wound. You want to make sure that the patient tolerated it well. I asked him, was he okay before I finished, or before I lowered the bed. If there is a need for pain medication at that point, then I would, you know, do something different. Go, you know, make sure that we take care of that. But anyway, I've lowered the bed. Client's in a comfortable position. And I want to put the call light in reach, but I can't find it. So we'll just say I put the call light in reach. And then I wash my hands before I leave. And for me, I'm going to put on a clean pair of gloves. And I'm going to roll this up from the outside. I'm going to take my gloves off. I'm going to put them in there. And then I'm going to close it. Because now I'm not apt to touch anything that was contaminated. So this goes in the biohazard room at your facility. And that's it.